Hi, I'm Gwendolyn Sterk of Sterk Family Law, and I have the privilege today to be with Anna Minkina, and we're going to discuss changes in 2020 to the Medicare laws,
Correct.
As well as this concept of penalties.
Correct.
So, first of all, let's start with 2020. Boy, first of all, before we even get there, doesn't that sound outrageous?
It does.
2020. I mean, it was just 2000. Remember we Y2K?
That's right.
Okay, I think we're getting old, Anna. Anna and I have worked together for many, many years. So tell us about 2020. What's going to happen to Medicare?
So, a legislator came in with a new law or act in 2015, and they are going to phase out Plan F, high deductible Plan F, and Plan C.
Okay, a little foreign to people listening. What's Plan F?
Plan F includes the Part B deductible, which is $185.
Meaning it covers it.
Correct.
And so explain to people what that $185 deductible is, though.
So the $185, so when you have Medicare, you have Part A, you have Part B, and then the supplement, which is, Plan F. They have so many different numbers. It's like F, G, H, I, so many. So F covers the $185, which is Part B is office visits.
Okay.
So it's included in that. So what they're doing is they're eliminating the plans that include that because a couple things. One is there were a lot of doctors that wanted to get paid more, and they were going to be losing them as Medicare doctors.
Okay.
So they had to figure out a way to do that. And also they thought that because it was already included, that it was putting a burden on the healthcare system.
How so?
People were going to the doctor for, I bumped my finger for something very minor. So they figured that if they had them pay that $185, which is, once a year, then they, as they put it, they'd have some skin in the game, and they would think twice about going for, I cut my finger, or bumped my finger.
I hate to say this, but it sounds like a lot of maneuvering for $185, doesn't it?
It does.
Yeah, it seems a little strange. What if you're already on an F plan?
You can keep that. And if you're eligible, before January 1st, 2020, or you're already on the plan, you can keep that.
So meaning if you reached age 65 5 years ago and you're not on F, you could move to F yet?
Correct. You can move to F if you're still working and you retire because you were eligible before January 1st, 2020. You have the option.
Okay, what other changes in 2020?
The Plan C, which is a mega gap plan, which include that. So they're going to rename them and come up with Plan D, as in David, not Part D, Plan D, as in David.
Well, that's kind of weird because you already have a Part D. Isn't it going to be confusing?
It is. It is.
It sounds so weird. And so we talked about this in one of those sections in the podcast we did on scams where the mail went from this to this. It sounds like that's going to happen again.
It is going to happen again because it's going to be confusing for everyone knowing, the alphabets. Why can't I get F? Where is F? What's going to replace F?
What's the difference between A and B?
A and B. A is hospital.
Okay.
B is office visits and some of the exams and like x-rays and some other things.
Okay. And so that's not changing?
That's not changing.
Okay.
The cost might be changing for B, depending on cost of living in that. Right now it's $135.50. It only went up like $1 or $2, each year, but not very much.
And so people who might be on fixed income, this could be a significant change to not make light of it, but nevertheless,
sure.
It just seems like a lot of governmental maneuvering for $185 a year.
Sure.
But
absolutely.
Nevertheless, any other changes in 2020 that you anticipate at this point in time?
The Plan G is going to be a good alternative. In fact, I like the Plan G because the difference between Plan G and Plan F going forward, there's a difference in premium per month, and then all you have to do is you're responsible for the $185.
So Plan G, meaning there's a difference in premium, the premium is less?
Yes.
Okay, but under Plan G, just so that we're clear, if you're going and you want to change your plans, you could be subject to underwriting if you're already on Medicare.
If you're already on Medicare, but they might, and I'm not sure yet, but they might let you go to Plan G since
they're getting rid of F.
Right.
Boy, it's very complicated to navigate through all of this. And so then when you are on Medicare, you still have to match up your bills. So you go to the doctor.
Correct.
And when you get to the doctor, you need to make sure that you give both your Medicare card and your supplement card.
Correct.
And then your insurance company, your first will go to the Medicare, correct? And only that portion that's covered by Medicare then will be paid in terms of the 20% by the supplement.
Correct.
Or the gap or this F plan. Is that correct?
Correct.
I think a lot of people have trouble navigating that because you get the bill, you got to the doctor, and maybe the original charge was $300, but Medicare only approved it for $100, correct? So that $200, they're not supposed to come and collect that from you.
Correct.
Because they are accepting Medicare.
Correct.
People need to know that, because if you get a bill for that difference amount, don't pay it, right?
No.
Then the second thing to know in terms of managing this is, if you get the bill and Medicare has been applied, make sure that they go to your next step, which is either applying for the Medigap or the supplement coverage, correct? And then they're going to pay 20% of what's left of the 80% of what Medicare approved.
Correct.
So let's give that example again. If the service was $300, Medicare approved $100, Medicare is going to approve and pay for $80. And then your insurance is only going to pay $20. Now, if you haven't met your deductible, that $100 could go towards your $185 deductible. Correct.
Once a year.
One time a year. Got it. So all that is very difficult to navigate. So if you get a bill for the $20, don't pay it, right?
No. Wait until you see if your supplement covers it or where it is. But you're absolutely right. People pay for it right away.
People pay because your inclination is, I've paid my bills all my life. I'm going to continue to pay it. So knowing these changes in 2020, you even have to navigate a little further.
Absolutely.
And it's very difficult to match all of the bills. You go to the emergency room, you might have 10 bills out of the emergency room, right?
Correct.
You got the doctor, the radiologist, the blood works billed separately, the hospital billed separately. So it's very difficult to navigate it, and it's something that scares a lot of seniors.
It does.
And I think that they just have to make sure that all the insurance gets applied properly.
Absolutely.
And then know that out of pocket, $185 is their cap.
$185 is their cap for Part B if they, with the supplement.
With the supplement or with the Medigap plan.
The Medigap.
Correct. And then the last thing is that, can you explain to us, we talked about DD, Part D, and then Plan D. Tell us a little distinction so people understand that.
So Part D, right now, they need to know that Part D is the prescription drug plan.
Okay.
And so if you have a supplement, you need to have a Part D plan. And this is one of the things that we spoke about before, is that you have to have a prescription drug plan when you turn 65. I have so many people say to me, I'm not taking any medication at all. I'm healthy, I don't take any medication. But there is a penalty if you don't take your Part D when you're turning 65, unless you're on an employer plan,
right?
Employer plan, then there's a penalty for the rest of your life until you pick up that Part D plan.
What's the penalty?
1% of the average, the national average, and then per month that you don't have that coverage, and then they add it in to your when you get your Part D. So some people are paying right now, their plan may charge them $28 for the prescription drug, but their penalties are $50.
Unbelievable. So that is critical, that the penalty, be aware that the penalty goes on forever, or for a very long period of time.
Forever, until they, because they got penalized, they didn't take it when they were supposed to take it. And the reason they do that is because even though they're not taking medication now, it's like any other insurance. If you have some instance and you go into the hospital, you need that prescription drug coverage.
Sure. And so let's go one step further. How much, is there a cheap plan for Part D?
Oh yeah, there's many inexpensive plans.
And how inexpensive could we be talking about?
$14.
So you could end up with a $14 plan and a $50 penalty.
Yeah.
If you don't do it.
If you don't
from the very beginning. Any other penalties that you think is important for?
If you don't do your Part B when you are supposed to do it within 60 days, during your open enrollment, if you don't do your Part B, then there's again a penalty for the rest of your life.
And what is that penalty?
Depends again on income wise, and there's different levels on that, but there's penalties involved.
Interesting. And so that also goes forward. So here's the message. If you're turning 65 and you no longer have group insurance, or you're leaving your job and not going to have group insurance, and you're over 65, you must take this serious.
Absolutely. And talk to the Social Security office too, because that's a really important. They'll give you the the timeline when you can do it, and they're serious about the timeline. So make sure it's is it 30 days or 60 days depending on your situation. Make sure that you do it within that period of time.
Tell us how you can help an individual who's embarking on this journey.
I represent all the companies, and so I sit down with each individual and go through that. I go through their medications with them. I go through their circumstances, where they live, and what their needs are, whether they're on an employer plan, like I said, or if they're coming off it, and then advise their options to them.
Perfect. Well, if you're out there today and this is the time period and where your next life stage is, it's time to call Anna, right?
Thank you.
And you can contact our office as well, and we'll make that connection for Anna, and also deal with your estate plan and help you navigate through this life-changing event. We all go through life changes.
Correct.
There's different stages, and there's nothing we can do about it. my husband has an aunt, and her line was, the thing about time is it passes. And so whether we like it or not, time is going to pass. You're going to become Medicare eligible, and it's time to deal with this head on.
Absolutely.
So thanks for sharing this very important information.
Thank you.
Take care.